Obesity medicine is important because it represents the future of primary care. When you realize that 2/3 of our population are overweight and 1/3 obese, it becomes an important issue for most of us. Also realizing that obesity leads to so many chronic diseases such as atherosclerosis, heart attack, and stroke, it becomes even more important to treat. And the question is, why spend billions of dollars treating the complications when we can focus on the cause, which is obesity? And we really want to give thanks to groups like the American Society of Bariatric Physicians that support physicians such as myself. There is an obesity epidemic because the nutritional guidelines are upside down. And to understand this, we look back into the 1950s when the notion that saturated fat in our diet was somehow unhealthy for us and it would lead to heart attack and stroke. And the recommendation, therefore, is that we should eat less saturated fat in the diet and substitute it with carbohydrates or at least polyunsaturated fat. Since 1980, obesity rates in adults have doubled, obesity rates in children have tripled, and we have no other choice but to blame these nutritional guidelines for this problem. We now have over 10 years of experience treating patients using low-carb, high-fat diets, demonstrating weight loss and the benefit to their health and their cardiometabolic markers. I help my patients by redefining healthy nutrition. We rewrite the book on the nutritional guidelines and we teach them the problems about carbohydrates in the diet, how they're inflammatory and fattening, and how saturated fat in the diet wasn't bad in the first place. We give patients tools that teach them how to focus on the carbohydrate content of food. We also help patients by working with insurance companies. And unfortunately, in the 1960s, when health insurance really got started, someone decided that because obesity was a behavioral issue, that health insurance wasn't going to take responsibility to pay for these conditions. And we can all see that that was a bad choice. It hasn't gotten us very far. And so, along with treating patients' other ongoing medical problems, we address obesity. Why am I involved in obesity medicine? I'm frustrated. I'm frustrated because I've been a primary care physician now for almost 20 years, and I feel that medicine is spinning their wheels. We have patients eating unhealthy foods, and they get sick, and they come to the doctor, and we prescribe medications to these patients to treat these chronic illnesses that are directly caused by the unhealthy lifestyle and diet that they lead. And so, in the second half of my career, I finally understood nutrition and realized how we could make some significant change.